For this very special occasion to celebrate the University of Mississippi Medical Center. I'm Elizabeth Henry, healthcare legislative aide to Senator Thad Cochran of Mississippi. The Health Resources and Services Administration at the U.S. Department of Health and Human Services recently designated the University of Mississippi Medical Center as a National Telehealth Center of Excellence. Senator Cochran regrets that he's unable to be here today, but he's asked me to read the following statement on his behalf. I commend the University of Mississippi Medical Center for receiving this Center of Excellence designation. The UMMC Center for Telehealth is already a recognized national model for telehealth expansion. This federal designation recognizes the leadership role and will allow UMMC to demonstrate to a broader audience how telehealth can be used to increase patient access to care and decrease costs. As a telehealth center of excellence, UMMC will work with federal agencies, providers, vendors, researchers, patients, and other groups to address existing challenges to the adoption of telehealth, to establish standards and best practices, and to evaluate emerging technologies. Mississippians can be proud that our state's telehealth investments have set such a high standard and that our state is taking the lead in expanding this effort nationally. I look forward to the continued partnership between UMMC and the Department of Health and Human Services to promote telehealth research and best practices in Mississippi and nationwide, and I stand ready to help this effort any way I can. We are pleased to have with us today Dr. George Sigounas, the Administrator of the Health Resources and Services Administration, to formally announce the designation of UMMC as a Center of Excellence.
Good afternoon, and thanks, Elizabeth, for all the preparation here and inviting us here. I'm very pleased to be here today to announce the selection of the University of Mississippi Medical Center as a new Telehealth Center of Excellence. The Health Resources and Services Administration, or otherwise known as HRSA, will award about $600,000 a year for a three-year grant to the medical center to demonstrate how telehealth can be used to improve access to health care services in rural communities. With this funding, the medical center will focus on 4 key areas: assessing the impact of telehealth on healthcare spending, refining telehealth reimbursement and business models, encouraging patients and providers to accept telehealth, and last but not least, expanding research. The goals of the Center of Excellence match closely with HRSA's mission, which is to increase access to health care for people who are medically underserved or geographically isolated. Telehealth plays a vital role in expanding the delivery of care to the populations that HRSA serves. HRSA is home to the Office for the Advancement of Telehealth, which administers a number of important programs. These include telehealth networks, technical assistance and research, as well as efforts to reduce the burden of licensure for telehealth clinicians. We have seen an increase in the use of telehealth throughout other HRSA programs, including the community health centers, health professions training, and the National Health Service Corps. We look forward to working with the medical center to identify and disseminate best practices on ways to leverage telehealth technology. It can be a powerful tool in addressing health disparities in rural Mississippi and in other rural communities across the country. We also are looking forward to working with the Center of Excellence to find innovative ways to align its work with the department's priorities, focusing on mental health, the opioid epidemic, and childhood obesity. Finally, I would like to thank Senator Cochran for his strong commitment to advancing the use of telehealth medicine. It is thanks to his efforts that HRSA was able to secure funding to establish the Telehealth Center of Excellence program. Also, I would like to thank Senator Wicker and Congressman Harper for supporting and believing on telehealth medicine. Thank you.
Now we'll hear from Dr. Bill England of the Office for the Advancement of Telehealth.
I would like to join Dr. Sigounas in thanking you for the opportunity to be here today. I lead the Office for the Advancement of Telehealth, which is in the Office of Rural Health Policy in HRSA. As you've heard today, the University of Mississippi Medical Center is becoming a HRSA Center of Excellence because it is a pioneer in the field of telehealth. The university's Center for Telehealth has over 14 years' experience in the field of telehealth, and it has performed cutting-edge work in teleemergency care by linking many of the small rural hospitals in the Mississippi Delta with specialists at the medical center to serve patients in these very underserved areas. The Telehealth Center at the Medical Center operates a network of almost 200 sites throughout the state. It covers almost 3/4 of the state counties. In the coming years, the Center of Excellence will serve as a national clearinghouse for telehealth research, including technical assistance to those that may be trying to start new programs. Through this partnership, we hope to learn more about how best to deploy and expand telehealth technology. We also want to examine what clinical areas can best be served by telehealth. We look forward to aligning the Center of Excellence with, in Mississippi with our own telehealth research center, as well as our national network of 14 telehealth resource centers. We can take the lessons learned from the Center of Excellence at the University of Mississippi to the other regions of the country to benefit from their experience and their findings. So again, we thank you very much for this opportunity.
Now we'll welcome Senator Roger Wicker.
Well, it's wonderful to be here, and I'm glad, Elizabeth, that you called on me because I think they just signaled a vote. So I'm going to run across the street after we've had a chance to pose for pictures. But it's great to be here with our friends from University of Mississippi Medical Center and our friends from HRSA and the Center for Technology, and my good friend Greg Harper from the other side of the Capitol, to celebrate something that we already knew, that the University of Mississippi is a center of excellence in so many ways, but thank you for recognizing it, and thanks for the tangible 3-year reward that we're going to receive. You know, we have problems in Mississippi that you could just be worried about, or you could look at them as challenges that give us an opportunity for accomplishment. And that's what we've done with our problems in Mississippi, and particularly it's what the University of Mississippi Medical Center has done. We have the fewest providers per capita. We'd like to change that, but telehealth helps us get at that problem. We have chronic diseases. We have heart disease. We're in the stroke belt. And we wish we weren't. We wish we had better eating habits, although we do like that deep-fried taste. But we have diabetes, and we've made strides already, and you've recognized that, and I appreciate that through telehealth, and we've had good outcomes there. But this is a big step, and an opportunity for us to take some additional assistance and lengthen lives, improve the quality of life, and conduct research to make lives better, not only for folks in our little postage stamp of the world, as William Faulkner called it, but make lives better for people all over the United States and around the globe. So congratulations, Madam Vice President, and congratulations to all of you who've helped with this. Let's take this as an opportunity to make the quantum leap for healthcare. So thank you much.
Now we'll hear from Congressman Greg Harper, whose district includes the University of Mississippi Medical Center.
Thank you, Elizabeth, and for presiding over this meeting, doing a great job, and I certainly want to welcome everybody. This is an amazing accomplishment that we should all take great pride in, and it's not been an easy thing, but I certainly want to thank Dr. Sigounas and Director Bill England here from HRSA, and thank you, Senator Wicker, for your leadership and hard work. I know of no one who works harder than you do, and it's much appreciated by the people in Mississippi. And I don't know, I hate that Senator Cochran's not here for this announcement, because his hard work and his staff's hard work on this issue have been instrumental, and we're blessed to have two amazing United States senators taking care of the needs in our state. But to be a part of this and to be the Center of Excellence in Telehealth is an incredible announcement for our state, and I believe will assist the country and many other places that you would think already had a telehealth program going, and they don't. But this is the cutting edge of what is being done, and UMC, thanks to you, Dr. Woodward, and your predecessors, it is the gold standard for telehealth in this country. And as you continue that innovation, the things that it does primarily to help patients to make their lives easier. And so our role for Senator Cochran, Senator Wicker, and myself is to make sure that government regulations don't get in the way of innovation and that you're able to do those advancements and things that you need to do. And many visits can be done this way for the ease of that patient who has that geographic challenge that needs to be able to do that. So I suspect, though, as we look forward 10 years from now, when we're continuing all of this progress and you have someone on a telehealth feed and you say, yeah, you need to come in, we'll just send the self-driving car to pick them up and make it easy. So congratulations. What an incredible day for us, and congratulations to UMC on this selection. Thank you.
Now I'd like to introduce Dr. Luann Woodward, who leads the University of Mississippi Medical Center.
Thank you, Elizabeth. Well, good evening, everyone. We are all delighted to be here. It was 14 years ago, almost to the day, that the University of Mississippi Medical Center kicked off its telehealth program. And I'm delighted that, in fact, several of those key individuals who made that happen are here with us today. Greg Hall, Dr. Richard Summers, Dr. Brian Rutledge. We are glad that they're here today to see what it has become and still, in fact, part of it. For me, it was very personal. Our telehealth program began as Telemergency, and I am proud to be an emergency medicine physician and part of the team that first started using this technology back 14 years ago. I had the honor, in fact, of running the first code via telemedicine. And for the non-medical people in the room, that means a medical arrest. It was also very personal for me because I grew up in rural Mississippi. I grew up in a part of the state that is very rural and very underserved. The acute healthcare challenges in Mississippi are tremendous. The need is great. The stakes are very high. This makes it personal for all of us in Mississippi. What we have done with telemedicine over these last 14 years is we have made access less of a challenge. And we all know what that means to the patient, but what it means probably to most of the people in this room, what you may be most interested in, is in fact it has allowed for quality care to be delivered at a reduced cost. And everybody wins when that happens. I want to extend my appreciation to Senator Cochran for hosting this announcement today. What we have accomplished would not be possible without the support of his incredible staff. We are very honored and humbled by the degree of confidence that he and his office have extended to us. Thank you to Dr. Sigounas and England for your support and for being here and for joining us in this announcement today for the University of Mississippi Medical Center as a Center of Telehealth Excellence in Telehealth. We are honored to have received this recognition. I also want to thank Senator Wicker and Congressman Harper because they have marched down this road with us from the beginning, and they have fought consistently for good telehealth policy. We have been very proud to stand by them along this journey and to be part of it. We are very excited with this designation, and we know that what we learn in our county hospitals, in our schools, in the small nooks and crannies, the postage stamp of Mississippi, can be amplified and applied to others. And we also know that if telehealth can make a difference in a place like Mississippi, and it can make a difference for the rest of the country. Thank you.
Now I'd like to introduce Michael Adcock, the Executive Director of the UMC Center for Telehealth.
Thank you, Elizabeth. Wow. I'm going to try to get through this without breaking into song and dance. But we're very, very, you don't want to see that. We're very, very excited. Senator Wicker, Congressman Harper, I'd like to thank you personally. We've been here, I've been in this for 2 years and have seen the hard work just the last couple of years that you've put in, and I certainly appreciate that. Dr. Sigounas, Dr. England, thank you. All of our other friends, thank you for joining us today for this special occasion. I want to express our sincere appreciation to Senator Cochran for hosting this announcement today and for his tremendous leadership on telehealth, particularly as the Appropriations Committee Chairman, and for all he's done for our state throughout his distinguished career of service. We look forward to seeing him speedy return back to Washington. On behalf of the UMMC Center for Telehealth, we are honored and humbled by the designation as a Center of Telehealth Center of Excellence from the Department of Health and Human Services, Health Resources and Services Administration. Thank you for entrusting this important work to the University of Mississippi Medical Center. While this program is a new undertaking for HHS and HRSA, we will be up to the challenge. We are up to the challenge. You see, our program's story is about creating successful telehealth services without an example to follow. Telehealth in Mississippi was established because of need. Nowhere in the nation are healthcare challenges greater than in Mississippi. We lead the nation in the prevalence of multiple chronic diseases and have the lowest number of physicians per capita of any state in the nation. 53 of our 82 counties, Mississippians have to drive more than 40 minutes to receive specialty care. Telehealth provides a solution, bringing meaningful health care to people where and when they need it. Telehealth at UMMC began in 2003, and Dr. Woodward has gone through that with Telemergency. That has been a great program. The success in that program, from a cost standpoint, from an access standpoint, and from a quality of care standpoint, has allowed our center to grow. Our next service line in 2008 was telepsychiatry. We set that up to address the challenges related to mental health care, access, and poor mental health outcomes in our state. These services are delivered in multiple different types of locations, including hospitals and clinics, schools, and other facilities, reducing the stigma often associated with this care. Our program has proven high patient satisfaction and the efficacy of delivering this care via telehealth. In 2013, our program was designated as a center on our campus and quickly became known for building a statewide telehealth network providing effective and sustainable telehealth services. Today, the Center for Telehealth offers more than 35 medical specialties with telehealth endpoints in more than 200 locations across the state. These sites are located in 68 of our 82 counties. They're in various types of locations. It's not just the traditional hospital and clinic model. We're also in mental health clinics, federally qualified health centers, schools and colleges, a mobile health van, prisons, corporations, and patients' homes. Many of you have heard this many times. But we're out there where the patients are. We want to deliver care where they are and make it as convenient as possible. Through our program's history, we have innovated and built partnerships to bring health care to patients in our state. We're constantly testing new ways to deliver care and collecting data to determine the efficacy of these models. One such study is the Diabetes Telehealth Network, which many of you have heard about. It's a program in the Mississippi Delta to test remote patient monitoring for chronic disease management. We provided patients with uncontrolled diabetes daily in-home monitoring of their diabetes through technology, intervention when needed, and patient education. The results were tremendous. Patients significantly reduced their hemoglobin A1C and avoided thousands of miles in travel to see specialists. Numerous cases of diabetic-related eye disease were found and treated that would have otherwise gone unnoticed. From a cost-saving standpoint, no patients in our program had an emergency room visit or an admission to a hospital during the program. Our Division of Medicaid calculated the cost savings of this and say that the state saved approximately $3,300 per patient in this study. They took that and extrapolated it that if 20% of the Medicaid diabetics in Mississippi were on this program, it would be $189 million savings annually. There are many more success stories from our program, from the life-saving care provided by our telestroke and teleemergency program to the children across our state who are receiving specialty care in their communities through telehealth, the college students who are receiving mental health care in their student health care centers via telehealth, or the patients who can access a dermatology consult in their local providers' offices. Our programs repeatedly demonstrate the power of telehealth to improve health outcomes and improve people's lives. We now look forward to harnessing this experience as a Telehealth Center of Excellence to continue testing new models and determining the efficacy for patients in various settings. We will work diligently to improve patient and provider awareness of telehealth to improve engagement. Our center is dedicated to continuing developing ways to improve access to care while demonstrating the cost savings that can be achieved through telehealth. We look forward to continuing to bring information from the Center of Excellence to sites across the country so that others will be able to utilize telehealth to its fullest extent. Our deepest thanks for this immense honor. We look forward to the great work in the days to come. Thank you.
Thank you all for being here with us today. As you can tell, we're just a little bit excited about this opportunity for Mississippi, and we recognize that this is only the beginning. Being able to work as telehealth expands not only nationally, but within our federal agencies is an immense opportunity for Mississippi and for the University of Mississippi Medical Center, and we certainly appreciate your being here to celebrate with us today. Thank you.